Today's episode is sponsored by ICNA Relief. If you're looking to place your order for Qurbani, please visit icnarelief.org/Qurbani.
Good afternoon. Welcome to another program on ShuraTV's health segment. I'm Dr. Zachariah. Welcome. Hope you've had a wonderful week. We wanted to discuss this week the topic of arthritis. Arthritis involves hundreds of different conditions that involve pain and swelling of the joints and a stiffness of the joints. This is something where usually it happens across all ages depending on the causative factor, and it's something which is common in the US. We find it across the population, in young people who play a lot of sports, in middle-aged people who might have some type of infection or have wear and tear or stress their bodies to the maximum, and they get certain injuries which cause joint pain and swelling and stiffness. So these things are happening, and we wanted to discuss a little about the types of arthritis that are out there, what we can do to recognize first the type that we have, and then second, we want to recognize and discuss what we can do in terms of prevention, which is very important. And then if we do have the pathology, we want to discuss the types of treatments that are out there and what we can do to alleviate and mitigate arthritic conditions in our body. And also one important distinction is there's rheumatoid arthritis and there's regular arthritis due to wear and tear of the body. So rheumatoid arthritis is a condition which is known as autoimmune disease. And autoimmune disease is a condition where the body, as mentioned before on this show, does not recognize host cells versus foreign cells. This is when you get autoimmune disease, and then you get depositions and cartilage breakdown in the joints. And this can travel from joint to joint. It's a generalized condition, and if you hear of people saying that they do have arthritis, which jumps from joint to joint, and it's not chronic in one joint, then those people most likely have autoimmune arthritis. It could stem from multiple different diseases like lupus or other types of diseases, and gout. There's different types of bone diseases that cause that stiffness and the painful swelling of the joint, and that is known as osteoarthritis of rheumatoid or autoimmune cause. So that's the main distinction we need to make. What we're mainly talking about today is regular osteoarthritis that happens from wear and tear, from trauma or injury, from irregular use, bad posture, overuse of a joint. For example, there's a condition known as tennis elbow. Tennis elbow is something which a lot of people who play tennis get because they're always hitting the ball like this, in this motion or in this motion. And this repetitive motion causes osteoarthritis of this joint, this elbow joint, and they call it tennis elbow. The other thing that a lot of people get nowadays in the modern era is what they call tech, which is short for technology, tech neck, the neck, where they get the stiffness and arthritic neck, and that's 100% due to phones and devices. People, we advise them to hold it up like this and don't bend your neck down like this. But the majority of the people have this angle and this rotation of the neck. So this causes arthritis of the cervical vertebrae. And because it's repetitive, you're always looking like this, you're not looking at it like this. So we recommend that you hold your device up and you look at it straight. The more you look at it this way and you're down into it, the more you increase the chances of having that tech neck arthritis. And this is stiffness of those joints in the cervical vertebrae. And with time, that wears out and erodes the cartilage around those bones, and you get what's known as the stiffness and also the wear and tear and the friction as you move your joints. As they articulate, you're not going to have enough lubrication and cartilage in that joint. So that causes arthritis, which is an inflammation of that joint. So this is typical. We also have very common are the knees. People get, especially if you're past 40 and you're still running and you're still doing high impact exercises, which are not conducive to your knees and your hips. Things like running or jogging on concrete or overdoing it more than 2 or 3 times a week. There are people who are running every day for 5 miles, 6 miles or more. And these people, what they're doing is they're causing trauma to their knees at the end of the day. And they're advised to do their running and their high impact sports on things like ellipticals, where the tension and the friction on the joints is decreased. The wear and tear is decreased. One recommendation is for self-care of those of you who are prone to arthritis is number one to not overburden your joints with weight. 1 pound of weight is 5 pounds of stress on the joint. So if you're someone that can lose 10 pounds, that's 50 pounds of pressure off your joints. So for each pound, there's 5 pounds of pressure that's relieved from your joint if you lose that. And if you're overweight, for each pound you're overweight, that times 5 is what you're stressing your joints with. So that wear and tear eventually leads to osteoarthritis, which is arthritis of that bone or of that joint. And this is something now with the obesity epidemic in the US, you will see a high incidence of osteoarthritis, because the more heavier we are, the more pressure that it is on the joints, the more osteoarthritis we'll have. So this is something that we have to keep in mind, and what we have to do is, lighten the burden on our joints. What helps the joints? What personal care do we need to do to decrease this this burden on the joints? Many doctors will recommend normal resistance exercises for your body, which you're building the muscles, and the muscles can, if your muscles are strong, they strengthen and they alleviate the stress on your bones and joints. So that's something number one to do, to maintain an active lifestyle. It's very important to do that. And then in addition to that, you don't want to be taking in toxic substances which actually attack the joints. You want to make sure that things like alcohol, cigarettes, nicotine, vaping, recreational drugs, things like that, these things all destroy the linings of your joints and cause increased inflammation. So when that inflammation is increased, your joint health decreases. So you need to keep away from those things. So physical exercise, weight loss, consumption of toxic things, we need to stop that. Then you can also get into things like yoga, tai chi, swimming. These things are strengthening your muscles, number one, and also strengthening the tension between the tendons and the muscle and the bone, so that your bone is not stressed in terms of getting impacted or highly impacted. And then of course, if you do exercise and you do work out your joints, what you need to utilize are heat pads and ice compresses, which can help cool down the inflammation right after a good workout. That's something you can do. Looking to your food and your diet, It's very important, as I mentioned always on my programs, to have an anti-inflammatory diet. Anti-inflammatory diet will help your joints keep lubricated and keep functional. It's very important to keep that in mind. It's something which in the long run will give you better longevity. It'll keep you ambulating or walking for longer distances and longer throughout your life as you age and you get older. And then also what it does is it decreases the number of aches and pains that you'll have due to your joints, you know. So that's something which is common. Treatments for osteoarthritis, typically, you know, of course you have what's known as ibuprofen, which are the non-steroidal anti-inflammatories. Usually if you have some type of osteoarthritis, pain in the joint, a doctor will tell you, you know, take ibuprofen for 2 weeks, and if it doesn't go away, then you can go and see them to get further types of analgesics and possible steroids that they might prescribe to you. I would not, you know, take any type of narcotics for osteoarthritis, because those are addictive, and you know, we have a narcotics epidemic here in the U.S. We have addiction to these types of medications, so you want to keep away from those. You know, and then also the last line is immunosuppressive drugs. There are some osteoarthritis that are very severe, so they'll give you biologics for it, or if you have the type that's combined with autoimmune disease, they'll give you the immunosuppressive drugs. So that's basically the treatments that you'll get. Of course, you'll get physical therapy assigned, as well as possible injections with a pain doctor if your pain symptoms don't mitigate or don't get alleviated. You might get pain. So those are things that you get treatment. Again, alternative therapies for osteoarthritis of the knee or the hip or the joints, any joints, is PRP, which is platelet-rich plasma. Platelet-rich plasma decreases the pain, increases lubrication, mobility, and motility in the joint, and on the cellular level, it improves cellular health of the joint and prevents those cells from deteriorating. So that's something important that you can do. It's called PRP, and you can get that at your orthopedics clinic or other clinics that offer it. We also offer that at Genesis as well. So if you're interested, let us know. We can help you with that. But these things help your osteoarthritis and help you maintain your joint health, and you keep it lubricated, the joints lubricated, so that it doesn't deteriorate. Nowadays, a lot of these professional teams like the Chargers here in LA and the Lakers and Clippers and all these Rams, all their athletes get PRP regularly on their joints to prevent it from the wear and tear that it's accustomed to. You know, there's a lot of tension and pressure and stress on their joints because of the sports that they're in, and the PRP helps maintain those joints. So that's something that you can seek and get, and that'll alleviate those symptoms as well. Other considerations for breakdown of cartilage and the aching that you get. Again, there are supplements that are out there. People take glucosamine, chondroitin, they take collagen supplements, they take turmeric supplements, which are all good for joint health. All these things combined with good close supervision from your doctor and discussing it with your doctor to be on a plan would help you increase the longevity of your joints and help you remain mobile throughout your life. So this is important. It's very important because it's a utility, and your joint health is very important to keep maintained. We discussed the drugs, we discussed the signs and symptoms that you have, the stiffness and the pain and the swelling of the joints. And the other thing is, you know, part of self-care is not to let, if you have a chronic joint issue and you know you have it, at least do something for it. Don't let it just get worse and worse until it gets to the point where you're a surgical candidate. Because in the orthopedic office, it's you're going to an orthopedic surgeon, so they're the last option, and you're on the road to surgery once you're there. So you'll do the physical therapy, you'll do the pain injections, and then you'll do the surgery if those things don't work. So the goal is to prevent the degradation of the joint to the point where you'll need surgery. So if you need surgery, albeit great. Look up the percentage of the successful surgeries for that joint. Talk to your surgeon. They'll explain everything to you. Get the surgery if you need it. If not, prevention is key. You want to prevent yourself from getting surgery until it's absolutely necessary. So you can do all these other alternative modes that we discussed for treatment of arthritis. Once you exacerbate all that, then you can go to the final phase and get surgery if you have to. It's not a bad thing. A lot of people get knee surgery, a lot of people get hip surgery, a lot of people get neck surgery, back surgery. There's different types of surgeries that they get and different success rates. Discuss that with your doctor. Be open, be loud about it. Of course, be loud about it, but be cordial and nice and disciplined. But ask them all the questions you have. Don't be shy. The doctor's there to help you. They're serving you and your health needs, and they want you to be healthy. So in order for that to happen, you need to voice your opinion and your concerns and your fears and what you would like to see happen, what's going on. If the doctor doesn't have a complete picture of what's going on, he can't help you with your osteoarthritis. He needs to know what's going on. And there are also a lot of biologics that they inject now into the joint to keep you lubricated and keep you from getting that stiffness and that pain. So ask about that. They're there. A lot of doctors are doing it now. A lot of non-surgical treatments. These things are all present and available, but you have to ask. So it's important to be an advocate for your own health and get that doctor to explain all options to you. It's important. The insurances or your Medicare, it pays the doctor so they can take care of you. So please utilize them in a proper way and ask all the appropriate questions. That's very important in terms of osteoarthritis, and you don't want to get any type of misdiagnosis. Make sure that everything is looked at and that you're part of the medical decision process. That's basically it with osteoarthritis. There are many conditions. If you have any specific issues or questions, and we can refer you to a good orthopedic surgeon or just a general doctor that takes care of these issues and the pain, let us know. Comment in the comment section, and we'll get back to you, and we'll let you know how you can reach out and get good help to get your osteoarthritis taken care of. With that, I'd like to wish you a happy week, and we'll see you next week, okay? Take care.